Latrice is a 7-year-old who has been diagnosed with leukemia, a cancer that affects bone marrow and blood cells. Her doctor wants to start her on chemotherapy as soon as possible. Purine is a common chemotherapy drug. It works by entering rapidly dividing cancer cells and killing them. It was first used to treat leukemia in the 1950s. While the drug helped most patients, some had very severe and sometimes fatal side effects. In the 1990s, doctors finally began to understand why. Researchers discovered that an enzyme called TPMT breaks down and inactivates the drug. Further, they found that some people make a more active version of TPMT enzyme than others. The drug purine is toxic. When TPMT enzyme activity is low, the drug builds up. At high concentrations, the drug damages not only cancer cells, but also healthy cells, making patients sick. 9 out of 10 children have a genetic variation that allows them to make a version of TPMT enzyme with full activity. They will not suffer severe side effects from purine treatment. 1 out of 10 children make TPMT enzyme with only partial activity. They break down the drug, but much more slowly than normal. A full dose of treatment makes these children very sick, but a lower dose can treat the cancer without causing harmful side effects. 1 out of 300 children have very little or no TPMT enzyme activity. Because they cannot break down purine, the drug builds up to dangerous levels. These patients should be treated with a different drug. Knowing which version of TPMT Latrice makes will help her doctor choose the best treatment. He takes a blood sample for DNA testing. The lab runs a test based on SNP profiling. The test shows that Latrice has the TPMT variation with partial activity. Latrice's doctor confidently begins treatment with a low dose of purine. Latrice's story shows just one way doctors can use pharmacogenomics in the clinic.